Hey guys, I am here with somebody very special who has over 20 years of experience in marketing and communication and 10 years experience in practice management, dental coaching, and operations. As you can see, I'm here with Curtis Marshall, and he's the co-founder of Dental Intel. And he uses his passion and skills to help dental professionals nationwide take their companies to the next level. And that's exactly what I know they're doing. Dr. Brett Tobler said, Curtis is a fantastic motivator. I have to agree with Dr. Brett. Curtis is energetic, charismatic, and very personal. He's the kind of guy who makes friends everywhere he goes. And Curtis, I know we all at ADMC consider you one of our good friends. Curtis is a great resource for growing and promoting our business. Welcome, Curtis.
Thank you so much. It's like, I really appreciate you saying that. It's like somebody told you all my good things about me.
Well, I started to get to know you a couple of years ago, and I'm so happy that in the last 12 months, I've gotten to know you so much better. And you treat me like I'm the queen of the United States. I mean, I'm sure you treat everybody and make everybody feel that way.
Well, you are in line to be the next queen of the United States. So that's it. No worries. And thank you so much for having me today, Debbie. I really do appreciate it.
It was a request from our members at ADMC.
Oh, good. Yeah, and to be seeing everybody here later this year. If you're watching this after the 2019, I hope I got to see you and rub shoulders with you.
Yes. So Curtis, you said that you did some dental marketing for a dental office. So can you tell us a little bit more about that?
Yeah, that's actually how I got started into dentistry. I got dental work. I did a cosmetic case. Got dental work on me, and I loved it so much that the office said, "Hey, we'd love to have you help us out on getting more new patients in the office." And the reason why they wanted more new patients in the office is because it was one doctor, and they were getting two more that were coming from dental school. They're his sons, and they were going to come into the practice, so they're going to have 3 dentists, and they needed more new patients. And so we did a lot of marketing, and it was pretty cool because what we did was we brought in roughly per month 300 to 400 new patients per month into this office.
Oh my! Oh, wow.
And the way that we did it was we looked at numbers, right? We looked at, hey, this is what's happening. And I can remember vividly thinking, okay, or looking at the data and saying, all right, this is working, this isn't. Let's get rid of this. Now let's look at this and see how we can increase it more. One of those examples was a mailer, right? We found out that mailers worked. Well, then what we did was we took those mailers and we said, all right, here's 4 different mailers that we're sending out. Out of those 4 different mailers, which ones are working? This one and this one is, but these 2 aren't. Move those out. Now let's take these 2 and make 2 that are similar to it. And we just kept refining the process until it was really simple. It was push button. It was easy to get those new patients. And that's what we were doing, is we were getting a ton of new patients.
Well, I love new patients. I love new patients for my clients. And when I was working as a dental hygienist, I absolutely looked forward to those new patients. And most of all, what I look forward to is a relationship with them. I want them to stay. So can you talk to us a little bit more about that and, why new patients?
Oh, yeah. Well, that's the craziest thing. So I remember multiple times leaving the office. Same thing with you, Debbie. I loved being with them all the time. They'd come in, I'd put a big old smile on my face. I'd show them around the office, make sure they're comfortable. They got a water. They get to know everybody in the office. I introduced them to our wall of fame, which had all the doctors' plaques and everything on it. Sat them down, introduced them to the hygienist. Once they got treatment presented to them, I'd show them, hey, here's what you need to get done. You need to do 1, 2, 3, 4, 5. Let's do it today. And then on their way out, giving them a t-shirt, even walking them out to their door, right? At the end of every day, I would have to massage my face because I was on stage all day long, right?
Yeah.
Here's the craziest thing, though, that I didn't realize is that those new patients that are coming in, the people that break appointments are the most. We have new patients and we have existing patients, right? The people that break the appointments the most percentage-wise, new patients, okay? Add the patients who we present treatment to. Who accepts more, new patients or existing patients? Existing patients accept more. New patients accept less. That's what we're seeing across the board. Also, if a new patient is only in once versus an existing patient who's been in a long time, statistically, they are not going to be paying their bills like our existing patients are. So it trickles down the whole effect. Although we want and we need new patients, right? They're actually the work. They hurt us, and they are so difficult. It's crazy. So the question here is, why do we really want new patients? And Debbie, I'm going to kind of drill you for a second. What's the real reason that we want new patients?
So, during the economic decline, my phone rang off the hook at that point from doctors asking me, the hygiene department expert, help me get new patients. That was on their mind because they thought new patients meant dollar signs.
Okay, so that's one huge reason, right? New patients are going to bring in more dollars. Okay, once again, I thought the same thing until I saw the data nationwide. Here's what's nuts. If I get 5 new patients who come in and I get 5 existing patients, that same year, the existing patients do more production. Even with the, my existing patients, they've all accepted the treatment. There's no more treatment to be done. That's what we think, right? That's what we think. But when we look at it, and we look at 5 existing patients and 5 new patients, over that year, the existing patients actually do more than the new patients. So it's not so much that it's more, because it's close to that, but there's another reason. Any other thoughts? Why else do we want more new patients?
Well, we're hoping that they'll continue returning because they had a great experience.
AKA, they become an active patient.
Yes.
That is the only reason that we want new patients. I'm going to pin it up on the board. Please write it down. The reason to get new patients is to get more active patients. That's, yes, there's byproducts of it, right? Oh, I actually want to get people who have Delta Dental because I just signed up with it. Or I want to get patients who are just cash payers, or whatever reason it might be. The main reason, the only reason that we want new patients is to increase active patients, right? So with that being said, if I have 1,000 active patients and I'm getting, let's say, like I was getting in my office, 400 new patients that month. So May 1st, I have 1,000. May 31st, I got 400 new patients. How many active patients should I have at the end of that month?
Wouldn't we hope for 1,400?
We would. Bingo. Okay. If that's what we're trying to do. I love that, how you phrased it. What's really happening, Debbie? What's really happening?
Well, I think that there ends up being a revolving door. And that's where I believe that we need to attract treatment from our patients of record, active patients, as you're calling it, because they have a trust factor with us.
A freaking man. So that is the truth behind it all. Okay, so we see this happening, and now we're like, well, what do we do? I've got a solution. Let's get more new patients. That's exactly what we did. So let's think about this. You're in hygiene, right? If I got 400 new patients every month, like I was doing for this office, how often should I be getting a new hygienist? So I'm getting 400 new patients this month, 400 next month, the next month. How often should I be adding a new hygienist? Now, we were adding hygienists, but how often?
Yeah. Well, I think it sounds like if you have 400, you're going to need to add a new hygienist every month.
Very close. we're seeing about 800-ish, okay?
Uh-huh.
So about 800-ish, 800 to, depending, 600 actually to 1,200 is the range for a hygienist, depending on what's going on in the office.
Yeah.
So let's just say 800, okay, in this scenario. So that should mean that every 2 months, I should be getting a new hygienist. Or every year, I should be getting 6.
Right.
Right? And if I'm getting 6 new hygienists a year, that means I'm at minimum getting 3, I can't even put my numbers up, 3 new chairs every 6 months, right? At minimum. So that wasn't happening. We were getting a new hygienist 1 every year.
Oh my
Telling it,
revolving door.
no, the biggest. It was the biggest revolving door ever. Okay. So I'd get 400 new patients a month, but some months my active patient base, if it was at 5,000, for example, at the end of the month after my 400, I would have 990. Wait, did I do that right? 5,000. I said 5,000. If I had 5,000 active patients at the beginning of the month, and I got 400 new patients, at the end of the month, I would have 4,990. I'm 10 patients less
Yeah.
than when I started, which means I lost 405 active patients.
And imagine all the dollars that you spent if you're marketing for them.
Our budget now this was good, but our budget was over $35,000 per month.
Oh my gosh.
Okay, so we looked at all the numbers, and that actually worked to get a new patient. It worked.
Mm-hmm.
But the thing is that if we would have just kept half of what we were losing,
right,
not even that, 20% of what we were losing,
right.
I could have cut that budget in half.
When you have 100 new patients per doctor each month, I see the revolving door. That's what I experience.
Yeah. So although we want new patients, we're getting them almost for the wrong reason.
Mm-hmm.
We're getting them for more production. We're getting them to get more collections. We're getting them to fill the chairs. No, that's not what we want. We want to increase active patients. That's the reason.
Mm-hmm.
Now, if I want to increase active patients, though, I can actually increase it in one of 3 ways. One is get new patients. Another is to make sure that I don't lose any of my existing clients, right? If I don't lose any, I'm actually gaining. You gain by not losing, right? Mm-hmm. The third way is of those patients I have lost, those patients I haven't seen in 18 months, we bring them back into the fold, mm-hmm. right? So there's 3 ways that we could get new patients, more active patients. So if I'm trying to get more active patients, which is easiest?
To keep bringing back the ones that you've seen.
Correct. Don't let them fall. That's the easiest. Yet, we are always focusing on the hardest one, which is why I often say new patients are the worst, even though I love them.
I know. I feel that way. I feel your pain.
I love them so much, and they're so crucial to offices. But at the same time, if that's what we're focusing on and we're not focusing on active patients, there's something else that starts to hurt. Not only does our pocketbook hurt, but if we're not taking care of the patients, we're not taking care of, if we're not taking care of our active patients, we're not taking care of the patients themselves. Mm-hmm. The public does not understand the importance of dental. Every one of my team members, as soon as they start on, they're like, oh, the last time I was in the office was like 3 years ago. Uh-huh. Now that they work with you, all of my consultants, all you consultants out there, and they work with all of our clients, they are going every 6 months now.
Good.
They understand it. But their doctors, their dentists never taught them.
Exactly. Yeah.
So that's not only are we, by not focusing on active patients, are we hurting our dollars? But we're also hurting our patients as well.
Mm-hmm.
Does that make sense?
It totally makes sense.
Yeah, it's a pretty cool concept. If you focus on active patients, where are you today? Where are you at the end of the month? Where are you at the end of the year?
Yes, yeah, that was great. So what do we do next? What are our next steps?
Well, that's the key thing, right? So what? We learned something cool today. And what was the biggest thing for yourself, Debbie? What was the biggest thing that you took away from? I mean, we talked about new patients coming in. We talked about what's happening, the stats with those new patients. We talked about what's actually happening with those new patients. The fact that they're new patients, the fact that they're active patients. What stuck out to you the most? You personally?
Well, I like how you were I mean, I always have thought, because I'm always, my heart is in hygiene. And I didn't want to interrupt you or tell you the answers, but I always told those doctors when they called that they don't need to spend marketing dollars. They need to just take time to reactivate their active patients. They haven't been in for the last 6 months or so. That's what I told them was most cost effective. But what I really liked, you said, what I liked was that we want to get the new patients to become active patients. We want them to stay over 18 months. That's what I look at when I'm looking at my metrics from you.
That's the fact that you pulled that away is brilliant, because I was just first saying, hey, for active patients, keep them active. But you took it a step further. Get your new patients to become active patients. And I'm going to give you a little bonus here that wasn't planning on giving you, but a crazy statistic. This is one that we should all be focusing on, yet we're not. Everyone focuses on new patients.
Right.
Everyone. Out of those new patients, who's focusing on making sure that they come in for a future hygiene appointment?
Who's making them come in for their future? Who focuses on it?
Focusing and measuring the fact, are your new patients rescheduling for something specific? Great, they get a tooth pulled. Fantastic, they accepted case treatment. No, what I'm wanting to know is, of those new patients, because we're trying to get them active, just like you said, what percent, who's tracking and monitoring how many of those new patients are scheduling for hygiene?
Okay, so here's what I discovered. What I usually discover in the beginning is nobody's tracking and measuring it.
No.
So I always, as a consultant, I think it's as consultants, we need to say, you want to, what you expect, you have to inspect. You have to inspect what you expect. And that's where...
Expound on your inspecting. What do you mean by that exactly?
So I think, what we're teaching now is, and I kind of walk through with our teams, to have the Dental Intel app, and that the office manager and some of the other team members are looking at that app, and then they're reviewing patients that need to return, or what walked out the door yesterday without being scheduled. And we're following it up on the next day.
So key that you brought that up. I mean, that is, if you take away one thing, that I hope that's it, of what Debbie just mentioned there. Making sure we know where to improve. Oh, goodness. I'm sorry.
Looks like you're wanted in a lot of different places.
For 2 seconds. There we go.
Guys, he is so busy. He is so busy. I really appreciate your time here today. This is so brilliant what you're telling us.
You're so welcome. No worries. I just already told him that I'll call back later. So here's the biggest thing though. Like I said, out of those new patients, only 20 to 25% are rescheduling for hygiene. And do you know what doctors tell me every time I tell them that? Oh, well, how many of those are limited exams?
Oh my gosh, this is another thing. We actually did a whole thing last year on getting limited exams to be comprehensive exams.
Yes! Okay, so they use the excuse of, well, they're just a limited exam. Oh, so those people don't need oral hygiene. Is that
correct?
What you're saying? And they're like, oh, we probably should get them to come back in. Like,
Hello?
yeah. So it's just because we're always focusing on new patients and not active patients. If we're focusing on active patients, not only are we going to keep the existing ones,
He's getting choked up over it.
but the new patients, we want them to stay on as well. So making sure that all new patients get a future hygiene appointment scheduled.
Yes. Amen.
Does that make sense?
Amen. Okay, you're speaking my language here.
So the biggest takeaway that I would be saying to any consultant out there is to make sure that you're focusing on active patients. How can we increase active patients? There's lots of different ways, but the key is to focus on active patients, not new patients. New patients is a byproduct of active patients.
I love it.
That's the key.
We said the title of this is New Patients Are the Worst.
Well, they are, kind of.
And the answer to that is active patients are our friend.
There we go. I didn't even think of that.
A new title.
Yeah. Active patients are our new best friend, BFFs.
That's a great title. Now, one of our consultants here might use that. You're free. Have at it. We just created your...
Go get the URL. Just remember, my address is in Pleasant Grove, Utah. Call me and you can send me the checks later.
Hey, I want in on that one too. Yeah, that's going to be a great title for a course.
Debbie, that's the biggest thing though. And in order of, as a consultant, if you want to see that, the sad thing is, and I did this because we had a consultant in my office, is that when I was talking to him about my new patients, I would look at the list before I sent it to him and go, oh, that's grandma. Well, I'm not sending that one over because that doesn't count. This one over here, they were just shopping. I'm screening not on purpose to give him bad data. I just didn't want to give my consultant attribution that I didn't think was I didn't think was going on, right? So I give him that data. Now he's going to make decisions based on the data I give him. Mm-hmm. Okay? I wasn't ill intent on saying, oh, I don't want you to have our data. I was just saying, oh, my thought is you want this data for something different than what you really want it for. Mm-hmm. So for any consultant out there, if you want to get this data at no charge to see what's exactly going on in the practices you're either trying to sell or the ones that you're working with, we do what's called a snapshot, and you can see all active patients. You can see how many of those new patients are rescheduling for hygiene. You can see how many new patients they're getting. You can see how many they're losing. You can see all this at no charge. And for those who already are working with me, love you to pick my brain some more. Let's get on the screen call like this, and let's do it.
Yeah, you're just a wealth of information, and thank you so much. Now, can you tell us a little bit about the call-in site, please? Can you talk about that? Or is it?
So it should be out. By the time you watch this, it should be out. The Call-In Sites is a brand new product that we're offering out to the dental community. Right now we have Dental Intel, and what it's doing, it's grabbing all the data from the softwares, from practice management softwares like Dentrix and EagleSoft. Call-In Sites is now grabbing the data from your phone system and ultimately doing the exact same thing. So there's no more loss, because all I have with Dental Intel is saying, once they come into the office, this is what's happening. Now what I'm going to be able to say is, once they call into the office, this is what's happening.
Yeah.
Here's a huge thing that no one's tracking, and what we're going to start tracking, or that we are tracking with Call-In Sites. If I had 10 new patients call in last week and 3 of them scheduled, what are we doing right now, Debbie, with those other 7 patients?
Well, they're not doing anything with those 7.
Nothing. We now have a solution for it. Check it out. GetCallinsight.com. GetCallinsight.com. And you can see more about it.
Okay. So, Curtis, give us your phone number, please. Tell us your phone number to call you. Do you want us to do your cell phone or the office?
Why don't you shoot me an email real quick? Anybody feel free to shoot me an email, and I'll call you. I'll send you my.
Okay. So, what is your email?
Curtis, CURTIS, @dentalintel, INTEL.com.
Okay, great.
shoot me an email, say, hey, I saw you and Debbie online. Let's learn more and love to work with you.
Yeah, I just want to say, if for any of our consultants that aren't using the app, I love the app. I mean, I have it on my iPhone and I can log in whenever I want, I'll wake up in the middle of the night and have nothing to think about. And you can just log on and see what went on in your client's office. And it's like, yeah, it's pretty interesting. Can't live without it now.
And the app comes at no charge for anybody who has dental intelligence. And a lot of people don't utilize it. So I'm glad that you do. Thank you.
And if a client, like anytime a client talks to us, we actually get them set up so I can see from my end what's going on before they become a client. So it's been very helpful with that. Thank you so much, Curtis.
You're welcome. Thanks for having me. Really appreciate it.
Yeah, it's been such a pleasure. I always love chatting with you. So guys, reach out to Curtis at dentalintel.com. Thank you for joining me, Curtis.
You're welcome. Have a good day.
Thanks.